Welcome to the deep dive. Today we're tackling resilience. It's a word you hear absolutely everywhere. But here's the twist our deep dive found. We've got these really sophisticated theories about it, especially in public health. But the way we actually measure it, often it just doesn't quite match up. We're diving into this surprising, well, disconnect between what we say resilience is and how we track it in health systems. The word itself, it comes from Latin, meaning to jump back. Started in engineering, materials bouncing back, then ecology, psychology. But what really struck me was its explosion in global public health recently. So today, we're not just defining health system resilience. We're really unpacking how it gets measured, how it's used on the ground.
Oh, absolutely.
Hmm.
And the research volume is, well, it's significant. Our deep dive looked at 71 empirical studies
Yeah.
just between 2008 and 2019. And get this, over 60%, so like 62% of those studies, they came out after 2017. It just shows how critical and timely this conversation really is right now for policymakers.
That surge is fascinating. It really points to a shift in thinking, doesn't it? How has the basic idea of resilience changed for health systems?
It really has. I mean, if you link it to the bigger picture, we increasingly see health systems as these complex adaptive systems.
Mm.
Think of them like living things, ecosystems, maybe, always learning, changing, adapting. So the core definition became about how much change a system can handle, while still basically doing its job. But then big events like the Ebola crisis really hammered home a point. Resilience isn't just top-down. It's not just the system itself. It's also about individuals, their own actions, agency, and the whole social, economic, political backdrop.
Yeah, I can see that. That move away from just bouncing back feels much more, well, real world, especially when you look at actual crises. So tell us more about this concept of everyday resilience. How did that change things?
Right? Everyday resilience. That idea from Barasa and colleagues, it really shines a light on the sort of unsung heroes, the day-to-day cleverness, the resourcefulness of people actually in the system on the ground. And that's especially vital where instability is just normal. It acknowledges resilience is built from the bottom up too. And others like Blanchett gave us models focusing on these underlying management capacities, things like knowledge, how systems deal with uncertainty, how different parts depend on each other, and crucially, the legitimacy of institutions. Basically, how much do people actually trust the system? These all link to outcome levels, often simplified as absorptive, can it take a shock? Adaptive, can it adjust? And transformative, can it fundamentally change and improve after a crisis?
Okay, so we have all this theoretical depth,
Yeah.
absorptive, adaptive, transformative. But what did the actual research, the empirical studies measure? Did they capture all that?
That's a really important question, and honestly, there's a bit of a blind spot there. Most studies focus narrowly on specific crises, disease outbreaks, natural disasters, climate change effects. Nearly half just looked at maintaining service delivery, like tracking hospital beds during a surge or how fast vaccination rates recovered. But here's the thing. Despite all the theory about these deeper dimensions, most studies really only touched on absorptive and maybe adaptive capacities. Those really crucial aspects like institutional legitimacy or transformative resilience, that ability to fundamentally change for the better, they are hardly ever looked at, especially with numbers, with quantitative data.
So with those gaps, does that lean towards qualitative approaches being maybe inherently better for this, for capturing those deeper parts? Or can the quantitative side catch up?
Exactly. The review did find that qualitative studies, or mixed methods, they were generally better at capturing that wider range of resilience aspects. Quantitative studies often just struggled. They were limited by what indicators were actually available, what you could easily count. It really highlighted a gap. I mean, you can quantify service use or preparedness plans, sure, but measuring something like handling cross-scale dynamics or developing legitimate institutions, that's much, much harder. How do you put a number on trust, right? It's kind of like trying to weigh smoke. So what our deep dive really brings to the surface is this critical mismatch. The way resilience is applied and measured in health systems often just doesn't live up to the rich theory behind it. To really get it right, to understand these complex systems, the next big step has to be developing frameworks, assessment tools that properly blend both quantitative and qualitative insights seamlessly. Only then can we really start to grasp health systems as these complex adaptive things they truly are.
So as you think about the complex systems in your own world, maybe it's your job, your family, your community, take a moment. Is your approach to resilience just about bouncing back? Or are you considering those deeper gears, things like knowledge, interdependence, legitimacy? Are you exploring those adaptive, even transformative changes that build real long-term strength? Something to think about. Thanks for diving deep with us today.